Good afternoon, everyone, and welcome to today's update from Northwood. I'm Tara Wickwire, moderator for today, and with me I'm joined by Janet Sim, CEO of Northwood, and Josie Ryan, who's the Executive Director of Long-Term Care at Northwood. We'll provide some upfront remarks from Janet to begin, and then we will move to a Q&A session. And to ask us any questions, just add them to the Q&A box below, and then I will ask them on your behalf following remarks. So with that, I'll hand it over to Janet.
Thank you, Tara. Good afternoon, everyone, and thank you for joining us today. While we're seeing fewer cases of COVID-19 at Northwood, sadly, we are still dealing with very difficult loss of our residents from this virus. Our hearts break for those families who have lost loved ones. While we've made progress, we continue to deal with this devastating impact of COVID-19. Our residents are like family to us, and we grieve each and every one of them. I wish to express my sincere condolences for the friends and families who have lost loved ones. We share in your grief and sorrow. As we provide today's updates, we remain focused on providing care and comfort for our residents. It's been 8 weeks since we activated our emergency plan, and we're so grateful for the support we have received from our healthcare colleagues. We have been united in our fight against this virus. Together, we have put new processes and strict safety measures in place. We have learned from this and adapted our strategies to manage this outbreak. We will take what we have learned and do everything we can do to help prevent this kind of outbreak from occurring in our facility again in the future. With fewer active cases and more of our dedicated Northwood staff returning to work, we're beginning a managed transition process for staff. In fact, we welcome more than 80 of our colleagues back to work, and we expect more to return to Northwood in the coming days. We're thrilled with that. As our staffing levels stabilize, those colleagues from other healthcare organizations who so graciously stepped up to care for our residents will begin their isolation period before returning to the front lines of their home organizations. When we needed help, they answered the call, and we will be forever grateful for this support. We couldn't have done this without the support of so many organizations, including the Nova Scotia Health Authority, Department of Health and Wellness, the IWK, VON, EHS, Dalhousie, Shannex, Glenhaven, and so many others. We're so happy to have our friends and colleagues return to work. We have also cherished colleagues who are fighting their own courageous battle against COVID-19. We are sending our thoughts of hope and encouragement. We pray for the health and recovery of our staff and all of the residents fighting this virus. We also want to highlight and give thanks to volunteers such as Manveer Ball. Manveer is a Dalhousie medical student who has been helping our team immensely. He's been working 12-hour shifts 5 days a week supporting our medical team. His warmth, compassion, and kindness have been a welcome addition and so appreciated by our staff and our residents. You are truly our healthcare heroes. As we begin this transition phase of our response and recovery, we remain committed to providing the best care possible for our residents. We've established a recovery unit on site to treat and care for our residents, supported by medical experts, caregivers, working together to provide around-the-clock care. Most of our residents are now living in single rooms, which has helped to prevent significant further spread of the virus. There are some exceptions, however, for those couples or roommates who do not want to be separated. We have a range of medical expertise and support services on site who work together with our standing physician, hospice, and our COVID-19 care medical teams to support our residents. Our medical staff and interprofessional care teams are experts at end-of-life care and are managing the complex needs of our residents. Our teams meet daily to undertake full assessments of every resident and confirm recovery plans. We are singularly focused on the care and recovery of our residents. We continue to provide our team with the PPE and other resources they need to treat our residents with confidence and care. We're encouraged by the support we are receiving from our Northwood community. Initiatives like the Noise for Northwood and the generosity and donations coming from across the province to the Northwood Foundation have meant so much to our team. Thank you all so much. With respect to our updates today, they will be available on our website later this afternoon. But we are deeply, again, saddened by the losses we've experienced because of this virus. Yet, as I mentioned earlier, we are heartened by the recoveries we're seeing. Today, we're reporting a total of 223 resident cases, and that's one new case to report today, and a total of 95 staff cases with no new cases to report today. Sadly, we have 3 resident deaths to grieve today. Our thoughts are with their families. We've been in touch to offer our condolences and support. We are celebrating, however, that we have 129 resident recoveries to report and more who will be deemed recovered in the next few days. And we also have more than 80 staff who have recovered and returned to work. In closing, we remain steadfast in our commitment to provide the care and comfort to our residents in need. We know staying in touch with loved ones is so important for families, and we continue to connect with families and keep them updated on their loved ones. All of our long-term care residents at Northwood Halifax continue to be regularly tested for COVID-19, whether they have symptoms or not. We've been actively staying in touch with families to share the results and review their care plans. This important connection with families will continue. We continue to learn from this and will do everything we can to treat our residents with care, respect, and the dignity they deserve. Thank you. Myself and Josie are now open to questions.
Okay, so our first question, Janet, it comes from Jennifer Henderson at the Halifax Examiner. So she's asking, for staff returning to work, are they being tested for COVID first?
Absolutely. There's a well-established protocol that we have to go through with respect to public health, and we're following those protocols.
Okay, and her follow-up is, how many new cases among residents since Friday?
We are reporting since Friday. I'll have to gather that, make those additions since Friday to make sure that we're accurate. Can we respond to that, Lady Tara, just to make sure we have the accurate count since Friday?
Yeah, Jennifer will send that to you once we confirm. Okay, a question from Natasha Pace, CTV. Is the situation at Northwood considered under control at this point, and has any resident been hospitalized?
I can take that, Jen. We have had 2 residents hospitalized. One had passed away, but the other one is recovering well right now. We get updates, our nurse practitioners call to get updates daily on that person.
Okay.
And we continue to actively manage the situation here at Northwood. As we mentioned, the numbers are improving, but we continue to constantly change our plans and look for new ways to be able to respond to this virus and the challenges it's posing.
We do have treatment on site, just so people know that we do have oxygen and IV therapy.
Okay, and a follow-up from Natasha. How can you reassure people who use Northwood home care services that the virus will not be introduced into their homes?
So our teams are screened appropriately through our occupational health, like our staff in long-term care. Our teams are, the health home support workers are screening clients before they go in, and they have adequate PPE and have the protocols in terms of appropriate use.
Okay, and just one other one from Natasha. How has the smoking policy been dealt with since pandemic restrictions were put in place, and has social distancing been introduced in the smoking room? And she's wondering when.
Okay, so social distancing was in the beginning, we reduced the number of people that could use the smoking rooms. We have 4 smoking rooms throughout the facility. 3 are in the center building, and there's not many smokers in that center building, so it was relatively easier to manage. The Manor smoke room has a larger number of smokers in the Manor. The Manor has tested so much. There were so many less cases in the Manor, but we do have it under video surveillance. We did reduce it. And actually on the weekend, we did have a case that was a smoker, so we've closed the smoke room. So we closed it on Saturday, I do believe, and are reassessing. We did do swabbing and testing of all people who smoke, and we'll continue to do that. There is a 14-day incubation period, so we'll reassess as we're going, and we're working with the MOH on that. We did test all smokers on Sunday, and all came back negative.
Okay, another one from Jennifer Henderson. Will Northwood reduce its occupancy rate to prevent further flare-ups or second waves in the future? Janet spoke of helping prevent this again. If you could expand.
We currently have 78 vacancies, which is allowing us to develop the private rooms and the cohorting. We are in conversations with government in terms of what our go-forward plan looks like.
Okay. Those are actually all the questions we have. I'll maybe just ask for a last call. Here's one from Jennifer. When and why did Northwood engage National Public Relations?
That support has been invaluable. We've received media attention from across the province, across the world, and we wanted to be able to make sure we were transparent and responsive to all of that. It's not something we deal with on a daily basis, so having that support to be able to prepare, make sure we have the appropriate technology, ensure that we're as transparent as possible. It was the best decision we've made in a while.
Okay, and another one from Natasha. Will you be looking at doing a full investigation into how COVID-19 spread?
So that work is being happening now daily as every new case. Josie can attest to. She's part of the team that does that contact tracing, and we do see the data. We do understand that there'll be further reviews while we're in, as well as post outbreak, and we're very open to participate in this. We all want to learn, and we all want to make sure that we can do anything within our means to prevent this from happening again.
We also have the support of IPAC, which is the Infection Control and Prevention for Nova Scotia Health Authority. And on site, on any given day, there's 2 to 5 people in the facility, and they're doing audits, they're walking the floors, they're talking to staff, they're observing what's happening, they're working with our housekeepers, etc. So everything that we do is being audited, being reviewed, and if there's any suggestions, we make sure that changes are made right away. But ongoingly, as the situation changes, like every day, there is people in and people that we can rely on for support.
Okay. And just one more from Jennifer. What is responsible? What would you attribute to the latest new cases?
It's challenging around the new cases for residents. The new cases are on floors that are already affected, so we haven't seen new floors pop up. We did have something in 2 people in the manor show up positive, but we were able to take them from the floor and move them to the COVID unit. We're doing the contact tracing, so that's where we're looking at the smoke rooms to see if that's a potential source. As far as staff, doing staff swabbing and seeing if any of the staff. So if we identify a case, we go back to every staff member that worked on that floor and we do some swabbing to see if there was any staff members that had come back positive.
And the incubation period and the unknowns around this virus has been one of our biggest challenges in this battle against COVID-19.
You can test negative for 3 successive times, and then on the 4th time test positive. So it's and have no symptoms.
Mm-hmm. I think we sort of addressed this one, but another one from Natasha. Aside from single rooms, what else could have prevented this from spreading as much as it has?
As we've talked about, if we had have implemented our masks even sooner. We, as noted before, Northwood implemented the masking policy for staff about a week before the province required it. Again, hindsight's 2020. Would that have been helpful? Possibly.
The incubation period is the hard thing because it can incubate for those 14 days before people become symptomatic or even be able to spread it. So it's all if you look at our screening process, the initial screening questions were: do you have a cough? Do you have shortness of breath? Do you have a fever? We checked people's temperatures. There were no coughs, etc. And some of the symptoms that are coming out now can be as simple as a headache. So in the initial phases, we didn't have that list of symptoms, and now we have the list of symptoms. So everybody's screened for everything.
And the initial screening included travel, of course, and that was not a factor at all for us in terms of our screening processes and information that we gained from our staff.
Okay, thank you. I think that concludes the questions that we have. As Janet mentioned, sorry, one last follow-up is the terrible mysterious virus, these 2 cases in the manor, are they the first in the manor?
There's the first 2 on that floor. We have swabbed after that and we have no new cases, but again, there's that 14-day incubation period. We'll be swabbing for the next probably 6 weeks. Even if we have no cases, we'll continue to swab in case there's asymptomatic people there.
Very good. Okay, and as Janet mentioned, we post daily updates on the edwood.ns.ca. So you can go back and look for those. Jennifer, we will provide that information via email, confirm that number for you. But thank you everyone for joining us today, and we will continue to update with these events as necessary, but appreciate your interest and support. Take care all.
Thank you.
Thanks.